Good morning, Newark Beth, and thank you for joining this very important webinar this morning. I want to thank all of our physicians for taking time out of their very busy schedule to share with our employees and our community some really valuable information. This vaccine has been a topic of a bunch of misinformation, lies, propaganda, and I wanted to provide you with an opportunity like I had with trusted physicians to get the best, most credible information that you can possibly get in order to make an informed decision for you and your family around this vaccine. I spoke with many physicians, and I'm very fortunate to have the opportunity to be in a position to speak with physicians directly, and they were able to give me information. And I made the decision to get the vaccine for my granddaughter, Ava. I thought the vaccine is not going to kill me. COVID can. And so I made that personal decision. I would love for you guys to have the opportunity to speak with our trusted physicians so that you can too make the best decision for you and your family. So I'm going to turn it over to Dr. Cathcart.
Okay, thank you and good morning. Thanks for joining us. My name's Dr. Charlie Cathcart, and I'm the Vice President of Medical Affairs here at Newark Beth Israel. We have a great panel for you this morning to answer some of the questions that have been submitted. Dr. Bay, who's a member of the Department of Medicine and a lung doctor. We have Dr. Garcia, who is the Division Chief of Internal Medicine at Newark Beth. Dr. Aluya, who is also a member of the Department of Medicine and an internist. Dr. Engell is an infectious disease specialist, and he's the head of our infection control committee. And Dr. Sawaged, who's the chairman of OBGYN. So we do have a lot of questions that have been submitted to us, and there is the ability to enter questions into the chat if we have some time at the end, but we might as well get started right away. And Dr. Engell, I'll start with you. Can you explain how these vaccines work and address the question as to whether or not it can change DNA?
So thank you, Charlie, and thank you so much for allowing me to participate today. So the mRNA vaccines is what we have currently to protect ourselves and our families from COVID. What mRNA vaccines are is they're really little recipes to our body cells that explain to the cells how to create a piece of the virus called the spike protein that the body can then react to. So it's a recipe that shows our body how to create a piece of the virus, not the whole virus, so that our body can be fit when it meets the virus in the future, and that gives us immunity. And because it's a recipe for only a part of the virus, and because it is not a DNA vaccine, it can in no way affect the DNA. The mRNA disappears not long after it enters the body, after it's done its job. And our large trials have shown this vaccine to be very safe and effective.
Great, thank you, great answer. Dr. Bay, we've heard from people who want to know why do we need to get 2 shots instead of 1, like for most vaccines. Can you explain that process?
Yeah. Thank you, and thank you for allowing me to come on this webinar. Yes. Understand that the body at this particular point, this is a new vaccine, and the body is not aware, or this is a new virus, I should say, and the body is not aware of this virus. When you initially take the first dose, what actually happens is that's like a primer, and it gets the body, gives the body understanding that this virus exists. It allows certain cells in your body called antibodies to have memory, and that memory will allow, if this virus gets into your body, it will allow that antibodies to attack or to develop a system that may attack this virus. The problem is that because it's a new virus and we have no natural protection from it. The first dose actually is like a primer. It gets your body ready. But the second dose, when you get the second dose of vaccine, then the body has some indication of what this virus is about, and it allows the body to build a protection. Those antibodies actually have memory in them, and when that vaccine is given, it allows this memory to expand. So if you actually get the virus, then your body is ready to attack that virus, and it prepares your body to be ready to keep you well. Let's put it that way. Thank you.
Excellent. And just as a follow-up, we had received a question that asked about the level of immunity after the first dose versus then waiting for the second dose, 3 weeks for the Pfizer and 4 weeks for the Moderna. Maybe Dr. Bay and Engell, you can sort of opine as to the immunity after the first one.
Yeah, because and you understand the immunity just means that you're ready to attack that virus if it enters the body. As I stated, the first dose actually doesn't bring the immunity up to the level that it needs to be to make sure that everyone who gets this vaccine will be totally protected. That second dose brings it up to the level. Dr. Engell, you may be able to chime in on this one.
Yeah, the Pfizer, which is the makers of the first vaccine, actually looked at this. They looked at the amount of people who developed COVID after receiving the vaccine versus number of people who didn't receive the vaccine. And so it's thought to be between 30 and 70%, on average 50% effective in preventing COVID after the first dose. And then the second dose brings up the effectiveness to 95%.
Excellent, great. Okay. Dr. Garcia, now what if a patient or a person has already had COVID-19, but does he or she still need to get the vaccine?
Thank you, Charlie, and thanks for inviting me to join this panel. It's very important. This is a very, very common question. I'm so glad you're asking it. We meet every morning in Beth Prime Care with our staff and huddle, and we talk about issues and questions that staff have for patient care. And actually, this was a question that came up in one of our huddles. And the answer is that the FDA still recommends that people who've had COVID-19 and have recovered should still receive the COVID-19 vaccine if there are no contraindications to that vaccine, of course. And I just want to go back to what Dr. Bay, I thought he really explained immunity very well. And the reason for that recommendation is that we don't know how long the natural immunity, the memory that Dr. Bay is talking about that your immune system has after you recover from COVID-19. How long is that immunity going to last? So we think that it lasts, quite a bit, a few months. I think perhaps about 90 days in some studies, definitely a few months, but we're not sure. So because of that, we think it's important that people get the vaccine after they've recovered from the illness.
Very good. We also had a bunch of questions about people who have allergies or allergic reactions to latex, as well as autoimmune concerns. And Dr. Bay, maybe you can speak to whether or not these people should get the vaccination.
Yeah, I get this question often. A lot of my patients want to know if they have an allergy or if they haven't had an allergic reaction to something in the past, should they get the vaccine? Well, let's break it down just for a minute, and I'll try to make this as simple as possible. Allergies basically are, and I think of the allergies as seasonal allergies. Allergies may be to latex, or it may be to pollen, to cats, to dogs, those type of allergies, and even certain allergies to foods. You should let me put it this way. You absolutely should get the vaccine if you have basic allergies. And that is 110%. Think of autoimmune, and let's just break autoimmune diseases down. We're talking about things like arthritis, we're talking about lupus, we're talking about even type 1 diabetes is we feel is an autoimmune disease. So yes, those patients with autoimmune problems, 100% you should get the vaccine. Now, if we're talking about severe allergic reactions, and that is a reaction that may be what we're talking about is things like shortness of breath, facial swelling, swelling of your tongue, feeling as though you can't breathe. These are severe reactions. If you have had a severe reaction with any vaccine in the past, you should not get the COVID vaccine. And if you've had these type of reactions with a mRNA vaccine in the past, you should not get the COVID vaccine. Also, if your first dose causes you to have these type of side effects, such as I stated, the shortness of breath, the swelling of your tongue, swelling of your face, you should not get the COVID vaccine as well. Now, they've also talked about shellfish and things like nuts, and people have severe reactions to these. I think in this particular, the CDC is not absolute, they're not clear on this, so I would recommend you go and talk to your private physician about that if you have those type of reactions. Thank you.
Great, thank you. Let me just take a moment here to explain the experience of our vaccination clinic and how many people have come to get it here at Newark Beth. So 1,550 first doses have been given to the people that work here. And 275 people have now received both doses of the vaccine, and that means 1,800 vaccinations have been given out. And really, we've seen very little side effect from the vaccination here. Only of those 1,800 people, only 5 patients went down to sort of be observed in our emergency room, really out of what we would call an abundance of caution, not for any of really the side effects that Dr. Bay was just describing. But we've had a very good experience here. We have doctors and nurses up there during the vaccination process, and it's gone very well. Just to throw that out there with our experience. Another area of great concern for patients and people is pregnancy. And Dr. Sawaged, if a woman is pregnant or trying to get pregnant, is she still a candidate for the vaccine?
Thank you, Dr. Cathcart, and thank you for allowing me to be a part of this this event. Absolutely, the answer is yes. A pregnant woman or a lactating woman can and should get the vaccine if there are no contraindications, as Dr. Bay and yourself had mentioned earlier. We all know that pregnancy is a very beautiful time, very beautiful time for the family, for the mom. You know, and it could be a very exciting, beautiful experience. But we all know that sometimes bad things happen. And how do we prevent bad things from happening to pregnant women? Pregnancy puts a woman in a compensated state. What I mean by that is that a woman's body has to compensate for various changes that go on in pregnancy. And some of the changes that go on are an increase in blood volume. Sometimes the lungs have to compensate for the gravid abdomen or the belly, which pushes up on the lungs. There are certain postural changes that take place in pregnancy. So a pregnant mom is constantly compensating for all of these things. The reason why we give prenatal care and the reason why we try to optimize a mom's health is because once a mom gets an illness or a sickness, they can easily go into a decompensated state. We screen for diabetes in pregnancy, we screen for hypertension in pregnancy and all other kinds of disorders. And we also suggest immunizations in pregnancy, because when a pregnant mom is compensating for pregnancy, and she develops an infection like the influenza or pneumonia or COVID pneumonia, she can quickly spiral down into a decompensated state. And we all know, just from what we've seen from COVID-19, that a pregnant woman has a higher risk of winding up in the ICU, has a higher risk of developing the severe complications of COVID-19, and has a higher risk of dying from this disease than their non-pregnant counterparts. So that my answer is yes, absolutely. I think pregnant women should get the vaccine.
Great, thank you. And you mentioned lactating, but more specifically, if a woman is breastfeeding, does that vaccine have any effect on the baby that's nursing?
We don't have any studies to prove that it does have an effect on the babies, but from all of the information that we do know, from the animal studies that were performed and from what we know about mRNA vaccines and what we know so far about this particular vaccine, we do feel that it is very safe for a lactating woman to get the COVID-19 vaccine. This vaccine is not going to kill you. It's going to protect you. And yes, a lactating woman can and should get the vaccine.
Good, thank you. Dr. Aluya, you've been so patient. We received several questions that are really important here. This one, are patients who are on dialysis or on blood thinners, because so many patients are on these medications, can they safely get the vaccine?
Well, thank you very much, Dr. Cathcart, and it's a pleasure to be here amongst my very esteemed colleagues and senior colleagues as well. This platform is so important to reach out to our community within the hospital and outside of the hospital as well, to get us better informed about what the vaccine is and why we need to take them. We see patients every day and they have questions that are very concerning to them, especially with their chronic medical illnesses. So with your question, as you have just asked, while we do not have enough data concerning specifically those with chronic kidney disease at any stage, or those who are on dialysis, or those who have received kidney transplant, the benefits of taking the vaccine so far much outweighs, the disadvantages of not taking it. So it's recommended that individuals with chronic kidney disease, or those who are on dialysis, or who've received kidney transplant, get the vaccine.
Thank you. And Dr. Garcia, we have patients in our hospital population that have had transplants, and some have mechanical heart valves and other compromised immune systems who are looking to be vaccinated or worried about it. What would you say to a patient like that?
Yeah, I think this is really what's one of the big take-home, I think, messages of this talk, of this time together. We don't know a lot right now. Of course, we're still learning about COVID, but there are some things that we do know. And one of the things we do know is that patients with chronic illnesses, like Dr. Aluya mentioned, end-stage kidney disease, on dialysis, patients who have heart disease, patients who have cancer. Dr. Sawaged actually just mentioned pregnant women. Patients who have chronic illness, all these patients are at higher risk for severe COVID disease if they get COVID. And I know my colleagues on this call will share their experiences, but we have seen this happen. When you look at the studies coming out since our surge in March and around the world, we know that patients who are immunocompromised, especially our transplant patients who take medications to decrease their immunity, are at higher risk for very severe disease, ICU stays, intensive care unit, and even death. And so it's very, very important that patients get vaccines get the vaccine so that they can prevent COVID. Now, I'll also say this, though, as a caveat, is patients that are immunosuppressed, you know, the FDA does say that their response to the vaccine may not be as strong. You know, I think that Dr. Bay was mentioning that we do have a lot of diseases that are caused by immunity and problems with immunity, and patients who take medications that, especially in our transplant patients, their immunity may be lower and they may not be as protected against with the vaccine as somebody who doesn't have an immunosuppressed state. So that's why it's actually very important that even if you get the vaccine, that you wear a mask, because we're you know, we want to be extra careful, and we want to make sure that before we get all the data in, that we're fully protected in more than just the vaccine, but our other ways, social distancing, masking, and hand hygiene. So I think it's a very important question. I think that for myself, as a mom, as a daughter, in my family, people who have chronic diseases, I not only get the vaccine for myself and to protect my patients, but I also get the vaccine to protect my family and the community around me, so who may have decreased immune system and may be susceptible to more severe disease. So yes, so thank you for that question.
Wonderful. And, you know, I'll follow up with Dr. Aluya to some of the things Dr. Garcia said. Even after we have the vaccination, what does it mean you can't, should you take your mask off and run around? And so what would you advise your patient after they have the vaccine, what to do?
Well, thank you very much for that question. As a matter of fact, just like Dr. Garcia just alluded to, you take the vaccine, you know, to protect you and also to protect, you know, your family, friends, and people around you. It protects you from having symptoms of the disease or even severe symptoms that may eventually lead to death. But it doesn't mean that you will still not be exposed to the virus or even catching the virus, but it's just that, and even spreading the virus as well. So in as much as you protect yourself from the vaccine, but then you need to still wear your mask, you know, still be engaged in those quality measures that determine us to prevent, you know, others. And that includes wearing your mask, washing your hands appropriately, and social distancing as well. And those are the things that will truly stop the spread of the disease while we use the vaccine, you know, to protect us, save lives, and save our community and society.
Sure, great. Dr. Engell, a theme of many of the questions that we got from people were, you know, how do we know that these vaccines are safe? We know that they were made very quickly. It's a new disease, and vaccines came about a lot quicker than we're used to. What would you say to us all about the safety of these vaccines?
Well, first of all, I would say on a personal level, I would never recommend a vaccine that I hadn't taken myself. And I think for the people listening in our community and employees, I think it was noticeable how eager physicians were to get the vaccine early when it became available, because it is very safe. Why do we know it's safe? Because it's been studied in as big a population as all other vaccines are. The reason we were able to develop this vaccine so quickly is because the US government went out and spent billions of dollars on running the studies for the vaccine and the production of the vaccine at the same time. So instead of first making sure the vaccine is safe and then producing them, what they did was they started testing whether the vaccine was safe, with the understanding that they would also get money from the government to produce the vaccine. And if it hadn't been safe, they would have been thrown out and we would have moved on to the next vaccine. So this vaccine, the Pfizer vaccine, has been studied in about 45,000 people. About 30% of them, 35% are from underrepresented minorities. The Moderna vaccine has been studied in over 30,000 people, with about 30% of the people studied being from underrepresented minorities. It is well documented that it's extremely safe. During those studies, they don't only look at whether the vaccine works, they look at what kind of side effects people get when they take the vaccine. And the reality is that when you take a vaccine that bolsters the immune system, there's a high risk of side effects. Now, those side effects for most people is a little pain at the injection site, maybe a little redness, maybe a little tiredness, weakness, maybe slight fever, and that happens in up towards 80 or even in younger people, 90% of the population. But that passes within a couple of days, and that just means that your body is reacting to this safe vaccine.
Great, thank you. And Dr. Bay, I'll sort of continue on that theme. You know, about the side effects. What can someone do to, you know, alleviate those side effects if they have them? And what would you recommend to prepare for the second dose of the vaccination if they had experienced some side effects?
Mm-hmm. Yeah, the side effects, and we'll go over them, and Dr. Engell definitely covered some of them. Let me cover them. You know, pain at the injection site is one. A little discomfort, headaches can occur, as well as the fatigue. Low-grade fever actually can occur as well, and some of the side effects can mimic some of the symptoms that the COVID virus. But understand, this is not. We're not giving you the virus. The vaccine is not the virus, and you will not catch COVID from the vaccine. As far as pre-medicating prior to the vaccine, there should not be you shouldn't have to be pre-medicated prior to taking the vaccine. If that is necessary, then you should consult your physician 100% of the time. I'd just like to, if you give me a moment, I'd like to cover some of the things that I talk about in my office and my patients ask me, as far as, you know, African Americans and some of the mistrust with some of the health health therapies throughout the years. And this is ingrained in our culture and in our communities. Understand that this virus is very, very deadly. And the vaccine is the way that we as a medical community can prevent or decrease the chance of you dying from this virus. So do I recommend the vaccine? Yes. Is this virus deadly? 100%. And we see it in the hospital every day. So if you have any questions as far as whether to take it, if you come under the guidelines for taking this vaccine, you should have no question whatsoever. Take the vaccine. Thank you.
Thank you. Dr. Aluya, I just wanted to circle back to you real quick on the question about blood thinners in particular, because so many of our patients are on them. Is there any reason not to take the vaccine if you're on blood thinners?
Well, at this stage, absolutely not. I mean, when it comes to blood thinners, there are a few different types. The very common one that most people know and use is the Coumadin blood thinner, where you have to measure the blood levels at the time to make sure you know, you're therapeutic and that is working enough to protect you from what it's supposed to do. And then you have the other class where you don't have to measure, you know, the levels. But you know, with regards to, you know, the vaccine, there's no indication that you shouldn't take it when you're on blood thinner. You absolutely have to or should, as recommended, because the risk of not taking it so far outweighs the risk of you know, you not taking the vaccine. and that includes severe illness and death, and even long sequelae of the disease. So it's absolutely necessary that even when you're a blood thinner, you should take the vaccine.
Sure. Great. Thank you. And Dr. Sawaged, I just wanted to circle back to you real quick on an issue. The pregnancy is 9 months long. Is there any stage along the way where you'd be more nervous about the woman taking the vaccine, or is it, what's your advice there?
Well, my advice is that, you know, a pregnant patient should take the vaccine as early as possible to develop that immunity to the disease. Obviously, as the pregnancy progresses and the blood volumes start to shift and the gravid uterus starts to cause various dynamic changes in the body, I would like a pregnant patient to have that immunity in place early on in the pregnancy so that it protects them throughout the rest of the pregnancy.
Great, thank you. And Dr. Garcia, I have a question for you. You see lots and lots of patients on the outpatient basis. They walk in, they've got diseases like high blood pressure, diabetes, and they might be 59 years old, and they say to you, you know, Dr. Garcia, I really want to move up the list. I want to, do my comorbidities mean that I can, you know, get into the, when they put it at 65, can I get in there even though I'm a little younger? What kind of advice would you give to a person who's waiting and anxious to get the vaccine?
Wow, that's a big question, Charlie. Well, I think that one thing I want to say before I answer your question, if that's okay, I think it's important to just make a statement about a myth that I know that all of us have talked about with vaccines, is that COVID-19 vaccine does not give you COVID. I just want to make sure that we all understand that and are confident. You know, that is a question that I have gotten from patients and staff alike. So I think that's very important, just to say that these messenger RNA vaccines are not going to give you the disease. So that's very important. I just wanted to make sure that that's clearly stated. But in regards to the 59-year-old patient you mentioned, so we look to our state and local governments to give us guidance about vaccine distribution at this point. So we have been working, I know, as an organization to make sure that we give the vaccine as directed by our local Department of Health to the people who are at highest risk. So here at Newark Beth Israel and across our sister hospitals, we've really focused on giving the vaccine to the healthcare providers, you know, kind of like when you're on a plane and you're told to put the mask on before you help others, so that we're sure that we're protected, so that we can care for patients in the community and, of course, not transmit the virus to our patients. We've been very lucky that that's not something that happens in our hospital often. So that's the first tier. And of course, the second tier, as we've mentioned before, are patients who are very at higher risk of severe disease. And those are our elderly patients, some of which are in nursing homes and maybe at home hospice at home. Elderly patients, again, are part of that group that does really poorly with this disease. So patients who are of older age, older than 65, also are considered higher risk. And of course, if you're younger than 65 with comorbidities, you actually do have, again, higher risk than somebody younger without the comorbidities. So what I tell my patients is that, you know, this is a long road that we've been living through. These are difficult times, and it just seems like there's not a light at the end of the tunnel, all that we have suffered these past couple of months. But I ask them to just look forward to the people that they trust, their healthcare providers, their families, whatever source of information that they gather, our Department of Health, CDC, and NIH, to give them confidence that that everything is being done to get this vaccine out to everyone who needs it. I know, and I tell this to my patients, when I get that vaccine, I'm going to be making that call personally to tell you to come in and get it. So I can't wait till the day where that is the light at the end of the tunnel.
Okay, great. We've had some questions come in during this webinar, and I can throw them out to sort of the group to maybe to try and handle. One of the things that we know is that at Newark Beth, we've vaccinated we've given 1,800 vaccinations to 1,500 people, but that's not everybody at our institution has been offered a vaccine. And what do you think are some of the barriers to people wanting to accept the vaccine? And I throw this out to the group. To maybe Dr. Bay, you could take a shot at that one for me.
Yeah. I think that I think there are many reasons. The number one is that you don't know what the long-term side effects side effects may be from the vaccine. I think that a lot of people are asking that. I get that question all the time. Also, I bounce back to I know in my patients, which are mostly African-American patients, they are very concerned that, and you can believe that there are many things that I'm asked that my eyebrows kind of come up sometime. Is there a little robot in the vaccine? Is there a tracer that may be able to trace me for the rest of my life in the vaccine? And I tell them, I'm like, listen, this vaccine is given across the board, everyone. And I truly feel that everyone in the country will eventually get this vaccine. It's just this virus is just that deadly. So I think that people are questioning, especially those of us that are medically trained and work in the hospital. We see so much, and sometimes you have a question in your mind, and I think those questions has to be resolved. I think also with time and other healthcare workers getting the vaccine, and they're doing fine. They're not sick. They're not home and can't come to work, and they're doing fine. I think that worry about the vaccine will decrease, and more will come and get the injection. Yeah.
That's great.
Right.
Thank you.
If I may chime in here, one of the biggest issue or concerns that people in the community that interact with often enough have is trust of the vaccine, not just the vaccine itself, but the technology behind the vaccine. In the sense that one, they feel it was rushed. Two, it's a novel technology that's not been used before, and so we don't know what the possible short-term and even long-term outcomes will be like. And I've always said this, that the only thing that's permanent in life is change. And of course, some people say taxes, but I always add this, that the only thing that's permanent in life is change and the technology that drives that change. It has become really important as we approach a novel vaccine, that novel technology will come up to handle this novel virus. And since the short term of which we have the outcome for the vaccine is commendable to the medical and the scientific community. I mean, I think people at the end of it all should get Nobel Prizes for this, because it's unprecedented. The reason why I'm saying this is because the virus had, across the globe killed millions of people and done so much damage, economic, even cultural and physiologic changes and psychological, impact on our world that it's unprecedented. But thank God we have the science today, because in 1918, we don't have what we have today. And that's why over 50 million people died. So, but because we've been able to find some ways to abate the huge impact on death as we save, lives and properties, we must commend this technology. The reason why, again, I'm pushing on this, one of the things, if we look through life, when I talked about change, even the cell phone that we use, it's not the cell phone that we have 5-10 years ago. We started with the flip phone, and then from flip phone, we went to touchscreen, and then to incorporating internet and photo and film into what we have today with the iPhone 20 or what iPhone we have now. So also technology will change, and with regards to the vaccine as well. So it's a welcome idea, and it shouldn't frighten people, but people should learn to embrace it, as we have embraced the technology that's come up with cell phone, even the cars that we drive today. It's important that we must understand that. Now, before I conclude, the technology of mRNA, it's actually not totally new, and some people think it is. It was first, discovered, I think, in 1959 in California Tech, and the journey for which we have today, where we are, actually started in 1976 when I think Dr. Lang, I've forgotten his first name now, worked on, the capsule, the polymer that when he published in 1976 about the polymer that eventually carries the virus that we have today. And of course, Dr. Catalina Caraco in UPenn here initially started the study and work for which she was initially discredited because when she wanted to do this, she wanted to do it to treat metabolic diseases and not just to put it into vaccine. But thank God, it became an answer to what we have, and hopefully it will help our world change our law positively. And this is not the end of mRNA technology. It's going to be spread into other things, so we must be ready to embrace it and see, hopefully, will change how we manage disease henceforth and help us save lives and properties.
Thank you. Well, we're coming near the end, but I just want I want to ask our infectious disease specialist, Dr. Engell, when people talk about herd immunity and they would just prefer, I've got a question here about that element and herd immunity, and what does that mean, and what does that mean for this specific disease, COVID-19?
Well, so taken at the very basic level, we all, whenever you have anything new, we're all concerned about new technology being used the first time. As a clinician, I certainly did my research 9-12 months ago to see what we were dealing with. And I went and I got the COVID vaccine, not so much for me, but for my parents and my patients, so I wouldn't give this virus to them. And when Dr. Aluya and Dr. Bay and Dr. Garcia and everyone on this call gets their COVID vaccine, they are also protecting my patients and my parents. And the more of us that get this vaccine, the more of us can sleep well at night knowing that our loved ones and our patients are safe. Because as long as there are people in the country that are not vaccinated, this virus will continue to replicate. And that means that the goal is to get over 90% of the population vaccinated to protect our loved ones, to protect our weak members of society, to protect the elderly, and being selfish, to protect ourselves.
Great, thank you. Well, I will wrap up here. I want to thank our panelists for your coming today and answering these questions, very difficult questions, and I learned a lot from all of you, and I hope that the people on the webinar could also learn from you too. But thank you so much for participating today, and we can have these as often as we need at Newark Beth Israel until our patients, our staff, and the city of Newark is safe. So, thank you.
Thank you.
Thank you. Thank you.
Thank you.